Hi, everybody. My name's Carrie Brown. I'm sorry we're not actually getting to meet in person because I feel like I didn't really get a chance to know you guys because I was away on sabbatical last year. But for those of you who are in first year, I will get to see you in January, so that'll be really nice. The module is about psychological well-being in the workplace, reducing health and safety risk in occupational therapists and their clients. And we're going to pay particular attention to the occupational therapist's workplace because, well, you'll see as we go along, but we tend to overlook our own needs in our efforts to work with our clients. So, how the process is, there are a series of several short presentations because just for length and for file management and stuff. So we'll walk through that. And if you have any issues or concerns or questions or whatever, you have my email address on eClass. So send me an email. Don't put your question on eClass because I may or may not see it. But if you email me, for sure, I'll get it. So at this point, some of you might be thinking, well, okay, yeah, I understand psychological health is really important in the workplace, and I understand why some people's workplaces would be very, very stressful or very unhealthy for them. But I'm not really sure. How does this relate to OT's workplace? Because we're healthcare providers, we should be able to create these wonderful workplaces for ourselves. And we shouldn't experience all of these problems. We shouldn't be experiencing stress because we're healthcare providers, not healthcare consumers. That's the mindset that we have. But remember, having insight and being a healthcare professional doesn't immunize you against anything, right? It's very common. And so it's very common for people to have psychological health issues within their work environments. And unfortunately, we live in a society where that's still highly stigmatized. So the next thing I'm going to ask you to do is to, again, pause the presentation and take a look at this TED Talk by Ellen Sachs. And it's a very powerful talk. It's about 12 minutes long. And I think you'll understand what I'm trying to say about, it doesn't really matter how intelligent you are, how much insight you have. Psychological health issues can affect us all. So pause the presentation and take a look at Dr. Sachs's TED Talk. Okay, so if we were all together in class, we'd have a chat about that. But instead, I hope you find a friend or a family member and say, hey, watch this and let's have a talk about it afterwards. And or if you're going on placement, maybe show it to people on placement and have a talk, because TED Talks are fascinating, right? And there's all kinds of ideas that come out of them, but they're all that much better when you share them with other people. And unfortunately, we're not going to be able to do that in this type of asynchronous online course. And I'm not going to ask you to type a whole bunch of reflections about it or anything, because I think that's the spontaneity of your responses is lost for this type of an activity. So we're going to move on now and talk more specifically about OTs, occupational therapists, and their stress. So the most recent figures from a nationwide survey, it's 2007. Unfortunately, that's a long time ago, but we all know what happened with Stats Canada and the type of data that they collect. So this is the best we have to go on right now. 2007. There was a ranking of healthcare professionals related to stress. How much experience did they believe or how much stress did they experience in their workplaces? So where do you think OTs ranked in this? Were they number 1, number 3, 5, 7, 9, 11, 15th? Where did we fit? Well, we actually came out pretty high at 7th. Okay, so compared, it was looking at all healthcare providers across the spectrum, neurologists and family practitioners and dentists and optometrists and nurses and social workers, pharmacists. So anyone related to healthcare, we came out at 7th. So that's pretty high. That means that even in 2007, OTs were saying something is not right in my workplace. Now, keep that in the back of your mind where OTs rank. And let's talk a little bit about the emerging is not the right word. There's a growing awareness that psychological health and safety in the workplace is a very significant problem. And this only has started to occur in the last, I would say, 5 years. Before that, people just sort of said, oh, it's your problem, suck it up, or get a new job, or get lost, or we'll hire somebody new. But there has been a great sea change for a variety of social factors that we don't have enough time to go into in great depth here. But people are starting to pay attention now. And we will talk about one of the significant drivers that has to do with industry. So anyway, a little bit of background, not to ramble at you too long here. Canada is considered a leader because of this document that was produced in collaboration with the Canadian Standards Association and the Mental Health Commission of Canada. An actual standard. Now, it's a voluntary standard at this point in time as opposed to a mandated standard, but it has extraordinary guidance that's available through it. And you have a link to that in the course outline, so be sure and take a look. All I can say is it's an extraordinary resource that we have. So this was developed in 2013. Oh, and I say I have a typo there. That should be a capital M. And now is being rolled out across the country. A number of different initiatives are occurring. And one of the key drivers of these initiatives is industry. Okay, so corporations and for-profit organizations and insurance companies are all taking a very active stand in this work. And anybody want to hazard a guess? I'd love to hear your emails from you about why you think that's happening. I have my own belief about why there's so much behind this, but it's not for me to draw that conclusion for you. If you want to share an email with me and one that I can share along with the rest of the group, that would be great. Please send us an email, again, not on eClass. Okay, so let's move on. So there's that wonderful resource, and stay aware of it, bring it to the attention of your employers. You guys are going to be going out into the workforce soon. You are the people who are going to drive this change. Insist that your organization's occupational health and safety committees start to look at psychological health in the workplace, not just lifts and transfers, right? Those are important, but psychological health is long overlooked. So you need to get yourself on those committees. You need to push that those issues are being addressed. And these are the kinds of documents that are going to do it for you. Psychological health and safety in the workplace, the Canadian standard. Okay, so I talked before a little bit about insurance companies that are getting very involved in these issues. Great West Life is one example. Great West Life commissioned a website called Guarding Minds to provide awareness and resources for different levels of stakeholders in organizations. So there's some materials for individuals. Most of it is targeted at a higher organizational and policymaker level, which is a good thing, right? What can they do about it? Now, they describe their resources as designed to protect and promote psychological health and safety in the workplace. So it's things that employers should do to protect their employees because they have a responsibility to them. Resources allow employers to effectively assess and address the 13 psychosocial factors known to have a powerful impact on organizational health. They worked with researchers at Simon Fraser University to develop this, so we know the resources are evidence-based. And the 13 psychosocial factors we'll look at in a minute. They also designed this website in response to current legislation and also some legislative change that is likely coming down the line, in provincially as well as nationally, so that employers can be better compliant and are not leaving themselves open to lawsuits, right? Legal standards increasingly require employers to develop comprehensive strategies for ensuring a psychologically safe workplace. Prudent, and this is interesting, right, because it's an insurance company, so they use the word prudent. Prudent employers need to develop policies and programs that meet these new legal standards, right? So this is not just about altruism. It's actually about the organization recognizing that they have a legal obligation and that there will be a cost, not just to their employees of not having good psychological health in the workplace, but also a cost to them potentially with litigation, or being found in non-compliance of standards. So they've made these resources available to all employers in the public or private sector, and there's no cost. So it's actually quite a rich resource they've provided. They define psychological health and safe, psychologically healthy and safe workplaces as one that promotes employees' psychological well-being and actively works to prevent harm. So there's actual programs that exist. They are working actively towards this. It's not just sort of, well, hope for the best, and when you get really stressed out or you're unable to manage your psychological well-being, we'll send you to a counselor. Instead, their focus is on reducing risk and preventing risk. Okay. While psychological health and psychological safety are developing to are deserving of equal protection, it is important to note that from a strategic perspective, ensuring safety in the sense of preventing psychological harm is a prerequisite to the promotion of health, right? So setting things up so that your environment prevents as opposed to just promoting. That's after the fact. Psychologically healthy company. Oh, goodness sake. See, that's why I don't like reading off of these things without your faces in front of me. Psychological health comprises our ability to think, feel, and behave in a manner that enables us to perform effectively in our work environments, our personal lives, and in society at large. Psychological safety is different. So there's psychological health, but there's also psychological safety. It deals with the risk of injury to psychological well-being that an employee might experience. So if you think things like bullying, you could be a very psychologically healthy individual, but if you are exposed to chronic bullying, that is a risk to your psychological safety. Improving the psychological safety of a work setting involves taking precautions to avert injury or danger to employees' psychological health.